Hello everyone, welcome to another video. Today we're going to do the introduction to the autonomic nervous system. We're going to look at the autonomic nervous system, the two parts, and as well as the drugs that can be administered in order to stimulate um, this nervous system and as well as inhibit. Mostly we're going to look at drugs that stimulates and inhibits the parasympathetic nervous system. Okay, so the introduction to the autonomic nervous system. There are two parts of the autonomic nervous system, which is the sympathetic nervous system and the parasympathetic nervous system. And the way I remember the functions of both of these is that the S in sympathetic nervous system stands for stress, which is the fight or flight or freeze response. So the S in sympathetic stands for stress, which is the flight, fight or freeze response. Okay, and then the parasympathetic nervous system, the P in parasympathetic stands for peace. This is what happens when you are at peace. Therefore, it is growth and metabolism. So the parasympathetic autonomic nervous system is mostly responsible for growth and metabolism. Okay, then if you look at this figure here, so this is the CNS on the left, is the CNS, which is the central nervous system. This is where the fibers of both the sympathetic and parasympathetic nervous system originate. Okay, so this yellow figure over here is a ganglion, and then there's two fibers going into the ganglion. Here's also a ganglion. So the ganglion that comes from the central nervous system is called a preganglionic fiber, and the fiber that goes from the ganglion into the effector tissue is called a postganglionic fiber. And also, both the sympathetic and parasympathetic nervous system have different lengths of preganglionic and postganglionic fibers. And the way I also remember it is that the sympathetic nervous system starts with an S, therefore the preganglionic fiber is short, S for short. So the preganglionic fiber is short, and the postganglionic towards the effector is long. And then the parasympathetic nervous system is just the other way around, is the preganglionic fiber is long and the postganglionic fiber towards the effector is short. So that's how I remember it. So sympathetic short, preganglionic short. So it's pretty straightforward if you remember it in this way. This is also what I just said, is that the lengths of the post and preganglionic fibers. Okay, then here's also a representation of the sympathetic as well as the parasympathetic nervous system. The first one is the sympathetic nervous system, and the way that I identify it is the preganglionic fiber is short, and at the bottom is the postganglionic nervous system. I believe the parasympathetic nervous system. Okay, and then this here is also the ganglia of the ganglion. The ganglion. So when the preganglionic fiber enters the ganglion from the central nervous system, there's a synapse, and the way that the stimulation is brought across is through a neurotransmitter called acetylcholine. So in the parasympathetic nervous system, the one at the bottom, the ganglia's neurotransmitter is acetylcholine, and the receptor is a nicotinic receptor. Okay, and the neurotransmitter close to the effector is also acetylcholine, but the receptor is muscarinic. So the easiest way to remember muscarinic is it goes to an effector, and the effector is a muscle. Therefore, it should be muscarinic. So the neurotransmitter is acetylcholine and it'll bind to muscarinic, whereas in the ganglion, the neurotransmitter is acetylcholine, but the receptor is nicotinic. So that's in the parasympathetic nervous system. The central nervous system, the ganglion is also acetylcholine, and the receptor is also nicotinic. But at the effector sites, there is a lot more receptors that are involved. It's much more complex, and we'll look at this a bit later on. So it's much more complex, and there's a few different receptors. Okay, cool. So let's look at these receptors in the central nervous system. The first one is beta 1, and the way that I remember it is that beta looks like this. Therefore, if you turn that beta around, it looks like a heart. And beta 1, your heart is your first responsibility. You should look after the health of your heart. So therefore, beta 1 receptors are mostly found in the heart. So if you turn that B around, you'll see that it is it makes a heart. So beta 1 is mostly found in the heart. It's mostly in the electrical conducting areas, such as the myocardium, the SA node, the AV node, and various other conducting regions like the bundle of His and things like that. So beta 1 is mostly found in the heart. Then beta 2 is mostly found in skeletal muscles, and also in the blood vessels within the skeletal muscles, but also in your lungs, in the bronchioles. And then the alpha 1 receptors is found in vasculature. It's found in the arterioles and also in the eye. So remember, alpha 1 is in the eye. The A looks like an eye. And alpha 2 is mostly found in the presynaptic, so it's in the ganglion itself. It is mostly found in the ganglion. So it's close to the nicotinic receptors. Okay. So moving on to the end organs of the parasympathetic nervous system. So remember, the parasympathetic nervous system is what happens when you're at peace. So it's growth and metabolism. It's when you're just chilling, it's at peace. So most that's going to be affected is your GIT tract, so your gastrointestinal tracts, your stomach, intestines, pancreas, your bladder will be affected by this. Also your heart and lungs and metabolism. So metabolism of oxygen and CO2. So most of this is carried by the vagus 10 nerve, but also some of it is carried by the cranial nerves, such as the cranial nerve 3, 7, 11, and 10, but also the sacral nerve 3 and 4. This is also important to know. So acetylcholine is made up from acetyl and coenzyme A, and acetylcholine is very easily and very rapidly, in a couple of milliseconds, broken down by an enzyme called acetylcholine esterase. So acetylcholine esterase is the enzyme that breaks down acetylcholine. And it's very important to know this because it's very important in the next section when we're going to do the drugs. So acetylcholine esterase breaks down acetylcholine. Yeah, just to enforce this is we don't have any drugs that look a bit like acetylcholine, but we do have drug that inhibits the enzyme acetylcholine esterase. That's actually spelled wrong, but it's fine. Therefore, acetylcholine, so therefore, if you give drugs that inhibits acetylcholine esterase, therefore it will stimulate the parasympathetic nervous system, because acetylcholine esterase will be inhibited, therefore it won't break down acetylcholine anymore, therefore there will be more acetylcholine in the synaptic cleft, and therefore depolarization and transmission will occur more so. And we also have drugs that are blockers of muscarinic receptors. And therefore, we have drugs that will bind to the muscarinic receptor and block it. So therefore, this is parasympathetic nervous system inhibitors, and they're also very important. There's drugs like atropine, which is plant-based drug, which stops the muscarinic receptor. So also the main function of the parasympathetic nervous system is for the GIT tract. And then there's also some examples. We're not going to do those two, but let's look at this one. Okay, so the parasympathetic nervous system also plays a massive role in the eye, especially in the iris muscle. And the iris muscle controls the dilation or the size of the pupil. So when the iris is stimulated by the parasympathetic nervous system, constriction of the pupil takes place. This contraction is called miosis, and it controls the amount of light in the eye. This is very important. So if we give drugs that are parasympathetic stimulators, therefore this contraction will take place more so. If we give drugs that are parasympathetic nervous system inhibitors, such as atropine, this contraction won't take place, and therefore the pupils will be more dilated, and therefore blurred vision might occur. It's also a bit dangerous for the eye because the amount of light, radiation, and things like that can be a problem. Okay. So in order to stimulate the parasympathetic nervous system, so remember we don't have drugs that mimic acetylcholine. We only have drugs that inhibit acetylcholine esterase. So in order to stimulate the parasympathetic nervous system, one should give drugs that inhibits acetylcholine esterase. Therefore, there will be more acetylcholine in the cleft, and therefore, stimulation of the parasympathetic nervous system will occur. Okay, so there are two types of acetylcholine inhibitors, or there are two types of parasympathetic stimulators. It's reversible and irreversible. So what reversible means is when the drug binds to acetylcholine esterase, when the drug is eliminated thereafter, that enzyme can continue its life and its function. So therefore it can function as an acetylcholine inhibitor once again. But irreversible means that when the drug binds to that acetylcholine esterase, that enzyme will for its entire life not perform its function, which is to break down acetylcholine. And irreversible drugs are pesticides. So it's organophosphates, and they are called malathion. Malathion are irreversible parasympathetic stimulators. Okay, then we also have reversible stimulators, and the way that I remember this is stimulators is an S, so therefore the drugs is also an S, so it's neostigmine and pyridostigmine. That's how I remember it. And also the injectable form is neostigmine, and the oral form is pyridostigmine. So once again, to stimulate the parasympathetic nervous system, one should give drugs that are acetylcholine esterase inhibitors, because we don't have drugs that mimic acetylcholine. Also, as I wrote here, irreversibles and agricultural pesticides and things like that. Okay, so pesticides or malathion is very potent poisons, and sometimes this poison gets ingested by people working with these chemicals, and what then happens is that the parasympathetic nervous system will be stimulated. Therefore, there will be a massive secretion of mucus and saliva and things like that, and it will cause this following symptoms: increased saliva, bradycardia, diarrhea, sweating, mucus production, things like that. So what mostly kills these people that ingested these pesticides is they will drown in their own mucus or in their own saliva. Okay, so what is the uses for acetylcholine esterase inhibitors? So what is uses for parasympathetic nervous system stimulators? The first one is in a disease called myasthenia gravis. Myasthenia gravis is a skeletal muscle where the person can't use all of his skeletal muscles. So then one would administer a drug called neostigmine, which will increase the parasympathetic nervous system, and therefore depolarization and conduction will occur more easily, and contraction of the muscles will occur. And there's the way that you can diagnose this is to diagnose this myasthenia gravis is to give a drug called intraphonium. And intraphonium is exactly like neostigmine. It's exactly like neostigmine. The only difference is it has a shorter half-life of only 10 minutes. And therefore, when you administer this drug and the patient can actually use most of his skeletal muscles, then one would know, in those 10 minutes, one would know that it is myasthenia gravis, and you can have a plan of giving the patient neostigmine. Okay, and also acetylcholine inhibitors, so parasympathetic nervous system stimulators, can also be used for treatment of Alzheimer's disease, which Alzheimer's disease is also recognized by the fact that it is a decrease in acetylcholine. So the two drugs that can be used is dopenosol and rivastigmine. Again, that stigmine is for stimulators of the parasympathetic nervous system. Okay, then you also get blockers. So blockers of the parasympathetic nervous system, and how they work is they block the muscarinic receptors at the effectors. So they block the muscarinic effectors, muscarinic receptors. And the drugs that can be given here is atropine. Atropine is a plant based, but it's also the phototype of the prototype drug that is used here. And also there's another drug called hyoscine, which is the synthetic version of atropine. And then there's also ipratropium, which is the treatment of asthma and COPD. So ipratropium bromide, so that's what you give for asthma. Ipratropium bromide. Okay, then side effects of atropine. So if one looks at it, generally, so atropine is a parasympathetic nervous system inhibitor. So it's a muscarinic receptor blocker. So what would happen is the parasympathetic nervous system won't be able to do its job, such as metabolism and growth. So what will it be affected? It will be a dry mouth because saliva won't be produced. Tachycardia, higher heart rate, constipation because it will stop the GIT tract, which is the parasympathetic nervous system is mainly responsible for the GIT, and also blurred vision because contraction of the pupil won't occur because the iris won't be stimulated. Yeah. Okay, then let's look at some illnesses. So irritable bowel syndrome will be will be given hyoscine. Hyoscine is just a synthetic version of atropine. So an atropine or glycopyrrolate is given for patients before they go under surgery. It prevents dry excretions as well as brachycardia. Okay, and then asthma, like I mentioned above, asthma and COPD will be patients will be given ipratropium bromide. So this is also a blocker because people suffering from this disease don't want that extra mucus secreted by the lungs. So it will be a parasympathetic nervous system blocker or an inhibitor that should be given. And then also pesticide poison, which is pesticide poison is just a parasympathetic stimulator. Therefore, you need to give a parasympathetic nervous system blocker or inhibitor. So therefore, you'll give atropine, which is the plant-based and the prototype drug for a parasympathetic inhibitor or blocker. So yeah, this is the first lecture on the autonomic nervous system, the sympathetic and nervous parasympathetic. So yeah, thank you for listening, and like and subscribe.